Infant feeding. The objectives for this presentation include: describe the newborn assessment parameters that indicate a readiness and ability to feed, compare the nutritional components of infant formula and human milk, identify the recommended nutritional intake and output for the healthy neonate, and describe breastfeeding techniques. Assessing readiness to feed. The infant must be greater than 34 weeks gestation. Prior to 34 weeks, the infant is premature and has not developed a suck and swallow. They must also be physiologically stable with a respiratory rate of less than 60 breaths per minute. A tachypnic infant is unable to PO feed. Quiet, awake, and alert states are necessary in order to feed. They must also exhibit a rooting reflex, a sucking reflex, be able to swallow, and exhibit a gag reflex. The nutritional needs of the newborn. Calories. The breastfed infant requires 85 to 100 kilocalories per kilogram per day. The formula-fed infant requires 100 to 110 kilocalories per kilogram per day. The infant may lose less than 10% of their birth weight, and this typically occurs within the first week of life. The infant typically regains this loss within 2 weeks of life. Nutrients include carbohydrates, proteins, fats, vitamins, and minerals. Complex carbs and fats are less well digested due to a lack of pancreatic amylase and lipase in the newborn. Water. It is not recommended that water be fed to newborns, as breast milk and formula supply the infant's fluid needs. Additional water is not necessary. The hierarchy of feedings. Human milk provides nutrients proportioned to meet the newborn's changing needs. Maternal immunoglobulins, leukocytes, antioxidants, enzymes, and hormones in breast milk are not found in formula. So the mother's milk at breast is the best for an infant. It is tailor-made. Pumping milk and feeding by bottle is the next viable option. Banked human milk is a possibility, as is designer milk processing. Hydrolyzed formulas include Enfamil, Nutramigen, Lipil, and Progestamil, Similac, Alimentum, and Advanta. Additional hydrolyzed formulas include partially hydrolyzed whey, which is cow's milk. Now, casein and whey are proteins in milk. Casein forms a large insoluble curd that's harder to digest than the curd from whey, which is very soft. Commercial formulas are adapted to increase the amount of whey so the curd is more digestible. A large amount of protein in formula is not digested but passes in the stools. The baby's immune system recognizes and may react to the protein in cow's milk, making it a common allergen. Additional hydrolyzed formulas include Good Start Supreme, partially hydrolyzed soy, Good Start Supreme soy, and then there is the amino acid-based Neocate and Elecare. Commercial prep of formula. When you are instructing a family who is planning to use formula as opposed to breast milk, the ready to use is the easiest option. You attach a nipple or pour directly into the bottle. You must refrigerate the open can and use within 48 hours. Concentrated liquid formula, you follow the directions on the label, typically equal parts of concentrated formula and water. Powdered formula tends to be more economical. 1 level scoop is added to 60 mL of water. Once mixed, use within 48 hours. It must be kept refrigerated. When instructing a family regarding formula preparation, you must also determine what the water supply is. Is it a well water situation in which the well water needs to be tested to be infant safe, or are they on a community-based water supply? If they have well water, you may recommend that they utilize bottled water instead of their well water. Bottle feeding techniques. Positioning. The most common position is the cradle hold. The infant is held in your arm. Obviously, the head is kept elevated above the stomach. the baby is fed the bottle, burping every 0.5 to 1 ounce. It's important to note that you do not allow air to enter the nipple as the baby is sucking, as this can cause increased gas. Frequency and amount of formula is every 3 to 4 hours based on infant cues. It's also important to instruct the family to not use the microwave to heat formula that's taken out of the refrigerator. This can cause burning of the liquid and cause severe burns in the infant's mouth. Propping is also not recommended. Coaxing a baby to eat more than what they want is not recommended. Saving the bottle for the next feeding is not appropriate either, and bacteria can become part of that formula in the bottle, may ascend into the formula, and so it is not safe to reuse that bottle once the infant has sucked on the nipple. It's also important to recommend that they do not put the baby to bed with a bottle. This can cause bottle mouth. The increased carbohydrates in the formula can cause dental caries, and it's identified at 12 months to 18 months of life when the child has black teeth. This is called bottle mouth. Breast milk composition. Lactogenesis 1 begins during pregnancy. Colostrum is high in protein, vitamins, and IgA. It's low in carbs, fat, and lactose. Lactogenesis 2 occurs 2 to 3 days after birth and continues for up to 10 days. This is transitional milk. Immunoglobulins and proteins begin to decrease, and the lactose, fat, and calories increase. Lactogenesis 3 is mature milk. Breast milk nutrients. Whey and casein, there is a high ratio of whey. Carbohydrates in the form of lactose. It improves the absorption of calcium and provides energy for brain growth. Fat. 50% of breast milk comes from fat. 50% of the calories come from fat, and that's variable between feedings in the form of triglycerides. Vitamins A, E, and C are included in breast milk. Vitamin D is low and requires supplementation. Minerals. Iron is added when solid foods are introduced at approximately 6 months of life. Iron supplementation is not required if breastfeeding during the first 6 months. Iron is required with formula-fed infants, and that is provided in the form of iron-fortified formula. Enzymes, pancreatic amylase and lipase is in human milk, and that aids in the digestion. Breast milk, the effect of maternal diet. The fatty acid content is influenced by the maternal diet. Protein, carbohydrates, and mineral content stay the same even in the malnourished mother. Vitamin levels are affected by maternal intake and stores. The balanced diet with increased protein and additional 500 calories per day is recommended for the mom who is breastfeeding. She must also continue taking her prenatal vitamins throughout the breastfeeding period, and it is recommended that she drink 3 to 4 quarts of fluid per day. Considerations in choosing a feeding method. Nursing's role is to support the mom regardless of what feeding technique she selects. Provide her with adequate information so that she can make an informed decision. Breastfeeding has many advantages in that it is the perfect feeding for her infant. It is readily available. It is the right quantity. It provides the right nutrients. It provides immunoglobulins and passive immunity. It is also the right temperature and can be easily provided throughout the course of an entire day. The reasons for not breastfeeding are many. For some women, there is the stress of returning to work, and perhaps she had a bad experience with breastfeeding a previous child. Formula. If the mother is choosing formula, you must support her selection of formula for her infant. The reasons for formula feeding are many. The convenience of being able to allow other people to feed your infant. That is incredibly important for the mom who must return to work within 4 to 6 weeks of giving birth. Combination feeding can also be an option, and in this way, mom is able to still provide some breast milk to her infant, experience that enhanced bonding experience by breastfeeding the infant perhaps at night and in the morning before going to work, and have the infant fed formula during the day by another care provider. Factors influencing choice. They can be physical, in that mom perhaps has had a problem with breastfeeding. She may have flat nipples. The infant may have an inability to latch or difficulty with latching. She may have had breast augmentation, and so there is difficulty with her breastfeeding for that reason, or she may have had her breast reconstructed secondary to mastectomy and breast cancer. So there may be many factors that influence her choice. Psychologically, mom perhaps had a bad experience with breastfeeding and does not want to breastfeed for that reason. Socially, her social circle may be supportive of breastfeeding or may not be supportive of breastfeeding. We need to discuss these implications and what it means for mom going forward socially to breastfeed her infant every 2 to 3 hours for the first 6 months of the child's life. Culturally, there are many different cultures that support breastfeeding. The Asian, Pacific Islander, and Hispanic population are very supportive of breastfeeding. The Caucasian population has increased the incidence of breastfeeding. The Black culture is also starting to embrace breastfeeding, and we see increased numbers of women breastfeeding their infants. Employment is a huge factor when discussing the choice of feeding. If mom must go back to work, if she works long hours, breastfeeding may be very difficult, as she must have a pump and pump every 3 to 4 hours to maintain her milk supply. She must also have access to refrigeration to keep her breast milk refrigerated. Other factors can include other children in the family and a work environment or a family environment that is not conducive to breastfeeding. Hormones and milk production. Sucking stimulus provided by the baby sends a message to the hypothalamus. The hypothalamus stimulates the anterior pituitary to release prolactin. Prolactin promotes milk production by alveolar cells of the mammary glands. Hormones and letdown reflex. The sucking stimulus arrives at the hypothalamus. The hypothalamus promotes the release of oxytocin from the posterior pituitary. Oxytocin stimulates contraction of cells around alveoli and mammary glands. The contraction of these cells causes the milk to be propelled through the duct system and into the lactiferous sinuses and is available to the infant. This picture illustrates the hypothalamus being stimulated by the sucking infant. Prolactin is then released for milk production. Oxytocin is released for milk production. Oxytocin also causes uterine contractions. This is a picture of everted, flat nipples, inverted nipples, and this is a nipple that retracts when it is compressed. Application of the nursing process with breastfeeding. We must provide a thorough maternal assessment for the breastfeeding mom. We must evaluate the breasts and the nipples. Are they erect nipples in which the infant can readily attach and latch for an adequate amount of time so that they're able to receive enough nourishment? Does the mom have enough knowledge regarding breastfeeding techniques? Regarding the infant, is the infant exhibiting infant feeding behaviors? Is the infant exhibiting a readiness for feeding? Nursing diagnosis includes risk for ineffective breastfeeding and what would be the expected outcomes. Application of the nursing process breastfeeding.